Today, we're digging into the story of a virus that kind of leads a double life. I'm talking about a microscopic sleeper agent that hits you with one illness when you're a kid and then can wake up decades later to strike again, only this time, it's a whole lot more painful. I mean, it sounds like something straight out of a movie, right? You get sick as a kid, your body fights it off, you get better, and you figure, hey, that's that. But what if the germ that made you sick never actually went away? What if it's just been lying low, hiding out in your body for years, just waiting for the right moment to make a comeback? Well, that's exactly the story we're unpacking today. So, the star of our show, the main character here, is a little something called the Varicella-Zoster Virus. We'll just call it VZV for short. And this virus, it is the absolute textbook definition of this whole one virus, two diseases idea. So here's the deal. VZV is the one and only culprit behind two completely different illnesses. The very first time you get infected, usually when you're a kid, it gives you varicella, which we all know as chickenpox. But, and this is the key part, the story doesn't stop there. After you've recovered, the virus goes into hiding. And if it decides to wake up later in your life, it causes something called herpes zoster, or as most people call it, shingles. Let's just break down these two identities real quick. On one hand, you've got chickenpox. That's the first round. Super common in kids, super contagious, and you get that classic itchy rash with little blisters all over your torso, head, and neck, plus a fever. Then you've got its second act, shingles. This is totally different. It's not an all-over rash. No, this is a painful, one-sided rash that traces the path of a single nerve. And it can come with some seriously nasty, long-lasting pain. All right, so let's start at the very beginning with that first encounter most people have with VZV, the good old-fashioned childhood classic, chickenpox.
So how does this whole thing even get started? Well, first is transmission. VZV is ridiculously contagious. It spreads through droplets from the rash or even just by breathing in the virus if it's in the air. Once it's in your system, it goes into this quiet 2-week incubation period, just multiplying away inside your immune cells. After that, it makes its big move. It breaks out into the bloodstream, that's called viremia, and it just travels everywhere, landing in your skin. And that's when you hit the final stage, the actual disease, with the rash and the fever as the virus's numbers just explode.
So what does a classic case of chickenpox actually look like? Well, the rash isn't just anywhere. It's mostly on the body, head, and neck. And here's a huge clue for doctors. The blisters show up in these waves, or crops. That means if you look at the skin, you'll see all the different stages at the same time. You've got new little blisters, some that are filled with pus, and older ones that are starting to heal and scab over. And all of this comes with that lovely feeling of being sick. You know, fever, chills, just feeling blah. You can even get sores inside your mouth. And of course, it is so itchy, which is a problem because scratching can lead to a whole other bacterial infection on top of it all. So after a week or two, your immune system finally gets the upper hand, the rash goes away, and you're back to normal. But this is where the story takes a crazy turn. The virus isn't really gone. It's just retreated. This is where VZV shows its true colors as this master of stealth. While you were sick with chickenpox, some of those virus particles took a little trip. They traveled up the sensory nerves from your skin and set up camp in the sensory ganglia. These are basically little nerve cell clusters right near your spinal cord, and there, they go dormant. They're not making copies of themselves, they're not causing any symptoms, they're just waiting, like a sleeper agent, just waiting for the activation code, which could come years or even decades down the line. And that, my friends, brings us to Act 2, the reactivation. When that dormant virus finally wakes up, it launches its return attack. And this time, it's not chickenpox, this time it's shingles. So what wakes it up? Well, the main trigger is a dip in a specific part of your immune system. The part that basically acts as a security guard, keeping all these latent viruses locked down. This naturally happens as we get older, which is why shingles is way more common in older folks. But it can also happen anytime the immune system gets weakened, maybe from certain cancers, from immunosuppressant drugs, or from infections like HIV. And believe me, shingles feels very different from chickenpox. It usually gives you a warning. For a few days, you might feel this weird pain or a burning or tingling sensation in one specific spot on just one side of your body. Then the rash shows up. But it doesn't go everywhere. It strictly follows the path of that one nerve it was hiding in. We call that a dermatome, creating this very distinct one-sided stripe of blisters. The rash itself goes through the same stages, but because it's so targeted and because of the intense pain, it's just so much worse. And if this happens to hit a nerve in your face, it can cause some really serious complications, like Ramsay-Hunt syndrome, which can paralyze part of your face. But for a pretty significant number of people, the story doesn't even end when the rash heals. The pain can stick around long after the blisters are gone. We're talking about 15% of patients here. And that leads us to the most feared part of shingles. For about 15% of people who get it, that's roughly 1 out of every 7, the virus actually damages the nerve it was living in. This causes a condition called postherpetic neuralgia. It's a persistent, sometimes debilitating pain that can drag on for months or in some sad cases even years. It's a huge reason why we take shingles so seriously. So what's actually happening to cause all this damage? Well, if we zoom way in and look under a microscope, we can see the virus's distinct calling card on the skin cells. It forces them to change, to fuse together into these giant, weird-looking cells, and to pull apart from each other. That separation is what creates the space for the fluid-filled blister. It's this specific pattern of damage that helps doctors identify what's going on. And funny enough, it looks a lot like what its cousin, the herpes simplex virus, does. Okay, so we've seen the virus's 1-2 punch. Now let's talk about the counterattack, how we can diagnose it, treat it, and best of all, prevent it from happening in the first place. Now, figuring out if it's shingles is usually pretty clear, but it can sometimes get confused with a flare-up of herpes simplex. The key differences are in the warning signs and the rash itself. With shingles, that initial pain before the rash is usually way more intense and lasts longer. And the rash is super strict. It stays on one side following that nerve path. But the real dead giveaway? It's what happens after. Only shingles can cause that awful long-term nerve pain. When it comes to treatment, the game plan is different for each disease. For a normal case of chickenpox in a healthy kid, it's really just about managing the symptoms. Rest, plenty of fluids, maybe some pain relievers. But for shingles, antiviral drugs are absolutely key. And with these drugs, timing is everything. You have to start them within the first 48 to 72 hours of symptoms appearing for them to be really effective at knocking back the virus and shortening the illness. But treatment is great, but prevention is the real game changer here. Before the chickenpox vaccine came out in 1995, getting chickenpox was just a normal part of being a kid. We're talking about 4 million cases every single year in the US alone. But since then, widespread vaccination has just crushed those numbers, dropping them by up to 90%. By stopping that first infection, you prevent the virus from ever getting the chance to go into hiding. And that really brings us to the big final question. We have the tools. We understand this virus's whole life story, from its first attack to its sneaky dormant phase and its nasty return. With a vaccine that works incredibly well to stop the whole cycle before it even starts, are we actually on the verge of ending the story of the Varicella-Zoster virus for good? It's a pretty powerful idea to think about, the chance to completely wipe out this two-faced disease for all the generations to